And welcome back. According to a recent study, a staggering 90% of Americans are at risk for developing heart disease. With that, we need to rethink how we approach nutrition and exercise, especially as younger people face increased risks. Dr. Khaled Khalif, cardiologist at Vital Heart and Vein, is here to talk about tips for maintaining a healthy start. Dr. KK, welcome. Good morning. Thank you so much for being here with us this morning.
Appreciate you.
You know, this is a really great conversation to be having on a Friday, right? Most people are off for the weekend. Perhaps this is the time to change those habits, right? To get into a healthier routine. Talk to us about ways people can implement changes in their lifestyle to ensure they are healthy longer.
Yeah, when it comes to lifestyle, Zach, it's very simple in terms of what to do, but it's hard to achieve. You know, it's that diet and exercise. We keep harping that over and over, diet and exercise. And if you're smoking, that's terrible too.
Yeah.
I would say smoking is probably the worst thing you could do. But when it comes to diet, maintaining a heart-healthy diet, now what does that mean, right? That's different for a lot of people. Heart-healthy, avoiding processed foods, staying away from saturated fat, trans fat, high-fiber diet. And then also when it comes to exercise, not just cardio, but weight-bearing exercise too. You got to keep a strong skeleton.
When you're having these conversations with patients, do you find these issues are oftentimes generational?
Yeah, I know for sure. I mean, I would say like our generation, we're more into fitness and exercise and stuff, which is great.
More aware,
Yeah, which is fantastic. But heart disease is happening. It's more prevalent in our age group as well.
In younger generations.
Yeah, absolutely.
Is that because of diet in some regard?
My personal belief is that the food processing system is killing us. That's what I believe. And that's why when I do harp on the diet to my patients, I tell them, look, don't forget you are a species of animal. I don't mean that offensively, but you are.
Yeah, absolutely.
And so you have to eat like an animal too. And that's the healthiest way.
Yeah. How can one, Dr. KK, assess their personal risk for heart disease?
Well, we got to know what the risk factors are, okay? The first two are what we call non-modifiable, your age and your genetics. We can't do anything about that. But then you got the big three: elevated blood pressure, cholesterol, and blood sugar, or hypertension, hyperlipidemia, and diabetes. Now, those things have to be checked off, meaning if you have them, they have to be controlled, either with medication, and you can try lifestyle. That's the beauty of lifestyle, is that diet and exercise treat the big three. So they're all related somehow.
And you, of course, can control that. With that assessment, what screenings should people consider?
Yeah. If someone is young with risk factors, not necessarily with symptoms, my favorite test is called a coronary CT angiogram. It's just a CAT scan, but it involves an IV where we give contrast, and it lets us light up the inside of the arteries of the heart just so I can take a look. It just gives me an idea of where you are. For example, I have plaque buildup in my heart. You know, for my age, I'm in the 90th percentile. That's not good. I have a strong family history and I have some risk factors. So I know what's in my heart and I take measures to help prevent it.
Absolutely. You mentioned risk factors. What are some lesser known risk factors when we're talking about heart disease?
No, that's a good question, Zach, because when I was doing my cardiology training, it was just age, family history, the big three, and then lifestyle, and that's it. But now we know there's some newer ones. The biggest one, I would say, is mental health. Stress is a big factor when it comes to heart disease, not just in the development of the plaque, but also in your risk of a plaque rupture, which is a heart attack. So I think what's happened is, in our society, we've become more autonomous and less connected to each other. We're all in our own head. And so that's really, really ramped up mental health problems. The other one is sleep. Not getting enough sleep,
rest, quality of sleep,
and also sleep apnea. And then the third is this chronic inflammation. We check a measure called CRP in the blood, and if it's high, we tell people your risk of heart disease is even higher.
Oh, wow.
Yeah, and a lot of that comes from our food.
Yeah, and listening to your body, right? I feel like where we're at in society now, it's go, go, go. It's that stress. We oftentimes are overlooking those symptoms, right? Those signs that there could be something more serious with what's going on.
Yeah, it doesn't have to be chest pain. Everybody thinks chest pain and arm pain. No, just feeling fatigued or short. To be honest with you, Zach, Most people with blockage, they don't even have chest pain.
Yeah.
Honestly,
Yeah.
I mean, the symptoms that I hear are just like, oh, not feeling good, short of breath, weak, tired. It's really not even chest. You have to have a really, really tight blockage to have chest pain.
In order to have that sensation, And
you also need to have a really tight blockage to fail a stress test. That's what most people don't understand. You can pass a stress test and still have a 60 to 70% blockage in your main artery.
Oh, wow.
Yeah.
Yeah.
So that's why I like the CAT scan, so I can visualize what's going on.
And it starts with having conversations like this and following up with conversations with your physician. Like we said, it's Friday morning, right? Now's the time to take action. If people really want to reevaluate what they're doing moving forward, now is the time to start. What are some simple measures they can do right now to prepare for that healthy lifestyle?
Okay, simple measures. And I have to do this all the time with my patients. Cut out the crap. That's the first thing. Sodas, chips, snacks, just cut it out completely. I mean, it's one of those things where you wouldn't believe, Zach, there's a lot of people that drink soda and have a bag of chips every day. Like every day. You just stop that. You can have it as a treat from time to time. And then also increasing our fiber intake is really good. That helps lower cholesterol and regulate sugars too. You can get that naturally in your diet with, fruits and vegetables. And then cutting out all the processed foods and added sugars is really bad.
Okay.
Those are simple steps.
Good stuff, Dr. KK. Thank you so much for stopping by.
My pleasure.
We do appreciate it.